Being in perimenopause is quite tricky, so we're basically trying to figure out if your periods have changed and if you have typical menopausal symptoms, and that is perimenopause. It's tricky because women don't have symptoms all month long. They may only have symptoms for certain days of the month, but you will typically see women presenting saying things like, I'm really tired, I'm very moody, I'm quite depressed, I have lost interest in having sex with my partner, things like that. And that is when you paint that picture together and then discuss their periods and their menstrual cycle, then we can sometimes get a clear picture if the woman is in perimenopause or not. Perimenopause is generally diagnosed based on your picture of symptoms. So I know a lot of women will say, well, can I have the blood test? The blood test for perimenopause isn't all that particularly accurate, and the reason is because, as I've said already, your hormones are fluctuating. So when we do a test to detect if you are in perimenopause or in menopause, we're typically looking to see if the particular hormone FSH has shot up. Now, when you're in perimenopause, your hormones are all over the place. They're up and they're down. One day I could check your FSH level and it could be really high. And a high FSH level is an indication that you are in menopause. However, I could do that test 2 weeks later and it could tell you that you're quite low. So really doing the hormone test is not that accurate a way of determining whether you are in perimenopause or menopause. It can be a little bit more useful in younger women, but generally not. We generally work with your symptoms. If you have had a change in your periods, albeit they're still there, they haven't disappeared completely, but if you have had a change in your periods, whether it be heavier, a shorter cycle or a longer cycle, and you have our other symptoms, which have already gone through and which will keep coming up on the screen as well, then we can assume that you are in perimenopause or menopause. Any woman that is presenting with all these symptoms at the age of 45 is considered to be in the menopause. I think it's quite important that women recognise when they're going through perimenopause, because you can take some very proactive steps to help yourself. So it can be quite distressing to have low mood, to have recurrent urinary tract infections, to feel like you don't want to be close with your partner, and to have memory lapse, memory fog, all that thing. That can be very, very distressful. So sometimes if a woman recognises they're in perimenopause, that helps. We can also treat perimenopause, and generally we treat it in the same way as we treat menopause. We treat it with hormone replacement therapy, albeit it'll be a different dose because you still have estrogen being produced in perimenopause as opposed to menopause when your estrogen has stopped. So although I would say your GP doesn't necessarily need to diagnose you as being in perimenopause or in menopause, it is important, if you are suffering quite debilitating symptoms, that you go and get checked.